British Columbia's provincial health officer says the COVID-19 pandemic and the toxic drug crisis are intertwined. Dr. Bonnie Henry made the comment yesterday after the BC Coroner Service released figures showing 2021 was the deadliest year on record for suspected overdoses, with more than 2,200 recorded. Dr. Henry says getting through the next phase of the pandemic is vital to helping people caught in the opioid crisis. Well, joining us now to give us a deeper look into BC's opioid crisis is Dr. Ramneek Dosanjh, President of Doctors of BC. Ma'am, welcome to Forum Daily.
Thank you very much for having me on your show today.
So how has the opioid crisis evolved and intertwined with the pandemic, as Dr. Henry is saying?
We've known since 2016 that BC declared a public health emergency in response to this ongoing crisis of illicit drugs-related toxicity and the overdose deaths. The numbers, as you know, have only worsened during the pandemic, and this is a crisis of epic proportions. While deaths have happened across the socioeconomic spectrum, there's been a disproportionate impact on young males.
And do you think the attention on the pandemic may have overshadowed the opioid crisis in BC?
I do believe it's been a tricky situation to navigate. As you can attest, the media coverage has been pandemic and COVID focused around the globe as of late. I do feel that for us on the ground, these simultaneous crises have affected our work life the same in a way, and only exacerbated the way that we're able to respond and provide for this magnitude of crisis.
So what are BC doctors and yourself recommending in order to tackle this growing epidemic, Doctor?
We know that the burden of the COVID pandemic has put immense pressure on an already constrained system. We've had increasing inequities, intermittent resources, burnout on the front line, as well as a deep sense of loss of connection and belonging. And we know that addiction is a multifaceted approach. We need to work on prevention, harm reduction, and urgent intervention.
It's really interesting that you mention the burnout among doctors and healthcare workers. We've been seeing this across the country. So tell us a little bit more about how this has impacted services for the opioid crisis in particular, Doctor.
Well, if you think about how about the access to hospitals and urgent care and our frontline workers, staff, healthcare workers, our emergency first responders, everyone has been overwhelmed with the response through COVID. And the opioid crisis, the 911 calls, and the urgent nature of immediate availability has only been exacerbated by COVID plugging up the hospitalization rate and access to care.
And are there any other factors that may have led to 2021 being the deadliest year on record for opioid deaths, Doctor?
I think this is absolutely correct. I believe that the access to healthcare and resources and all of the things that are concerning to the social determinants of health that impact all of our public safety and health have been constrained. And we have been under so much duress from the front lines to our government working very hard to try to correct this.
So what's at risk here, Dr. Dosanjh, if nothing is done to improve the opioid crisis here?
I think this is unacceptable. I feel that the way that we have gone, we need to act now. We need to get involved and try to implement strategies across our healthcare sector, involve as many people, including these patients and their families. It's devastating to watch this happen and not have an urgent crisis response. I believe that everyone has been trying their best in a collaborative effort, but we must act now.
Devastating to watch indeed, Doctor. About a minute left here, but what resources are currently available for BC residents that may be facing addiction right now?
So there's multiple avenues in which people can access care. And what I've alluded to are the harm reduction techniques. And we are having safe prescribing and safer supply networks that have been established and been effective in this crisis. We need to increase and bolster the infrastructure and support across the sector in terms of having people to have access to safe addiction care. Also, the understanding, we need to destigmatize how addiction is looked at in our public interface. We also need to provide more counseling support and more access to things that can improve the social determinants of health.
Dr. Dosanjh, thank you again for this inside look at BC's opioid crisis.
Thank you very much for having me today.